You know, as our population has aged, what used to be old at 50 or 55 isn't anymore.
Older drivers as a group are involved in a higher proportion of fatal crashes.
I stopped driving at night.
Over the last few months, I was like seeing double almost.
The lights were too bright.
Being in a fog is about what it's like.
Safe driving is dependent on a lot of factors. Your ability to see clearly and see hazards as they're developing are a major input in order to avoid accidents to begin with.
It's real tough on anyone when you go to a scene and realize that something could have been done to prevent this accident.
Chances are, if you're over 65, you've experienced some vision reduction caused by cataracts. Each year, about 14 million lens implant procedures to treat cataracts are performed worldwide. It's the #1 surgical procedure for adults over 65. Having cataracts affects your vision and more. Cataracts affect your life, especially reading, watching TV, or driving, particularly at night. This video will help you understand a breakthrough in lens implant technology that can mean safer, sharper vision after cataract surgery compared to traditional lens implants. It's called the TECNIS intraocular lens, and you'll learn how this breakthrough provides quality of vision that no other lens has been proven to provide. As we age, all of us lose what's called contrast sensitivity, or in simple terms, the quality of our vision declines. Our vision is not as clear in objects in lower light conditions, such as a great truck or a child in a light jacket at dusk, become increasingly harder to see. Cataracts make this decline in our vision even worse.
You can still see, but it's just dull, you know, nothing bright.
It's getting harder and harder for me to read. And again, I don't like to drive at night, and even when I'm in the car, during the daytime, if that rear view mirror, if the sun is hitting that mirror, then I'd have to turn the other way.
Well, I didn't like what was happening. I wanted to be able to see things, because I've always been able to see pretty well,
Before we go any further, let's learn more about what a cataract is and how it is treated. The human eye has two lenses that work together to focus light onto the retina. The outer focusing lens is called the cornea. The inner focusing lens is called the crystalline lens. Light rays pass first through the cornea and then through the crystalline lens and are focused onto the retina. From the retina, these light rays are sent as electrical pulses to the brain, where our mind sees a picture of what's in front of us. The natural crystalline lens of the eye is made mostly of water and protein. For most of us, sometime in our 60s, 70s, or 80s, some of this protein will clump together, causing the natural lens inside the eye to become discolored and clouded. This clouding of the natural lens is called a cataract and is usually a natural part of aging that can also be hereditary or caused by disease or injury. When the natural lens gets clouded, light rays become scattered and no longer pass clearly through to the retina. At first, this cloudiness may affect only a small part of the lens, but over time, the cataract usually becomes darker and harder and has a greater effect on vision. As cataracts develop, all objects, whether near or far, become blurred, and vision usually worsens. One of the results of developing a cataract is the loss of ability to see in low light situations or at night. Other signs of a cataract include hazy or blurred vision, colors that seem faded or not as bright as they once were, sensitivity to light, and frequent changes in eyeglass prescription. The only treatment for cataracts today is to remove the clouded natural crystalline lens, the cataract, and replace it with a clear artificial lens, or IOL. To remove the cataract, your surgeon will use a technique called phacoemulsification, or phaco for short. The phaco procedure begins with a self-sealing microscopic incision that allows the surgeon to insert a tiny probe. Next, the thin front surface of the capsular bag that contains the crystalline lens is opened to provide access to the cataract. Your surgeon then uses the probe to gently break up the cataract and vacuum it out in tiny pieces, making way for the placement of the TECNIS intraocular lens implant. The TECNIS lens implant is then inserted through the microscopic incision and into the lens capsule where your natural crystalline lens was previously located. Following the procedure, the TECNIS lens implant will provide safer, sharper vision, more like your own natural lens did when you were a young adult.
I was in and out of there in less than 2 hours. No pain, and I was totally unconscious, but yeah, it was just amazing how fast and painless it went.
It's simple, it's fast, and it's great to have it done. And you can see again, just like when you were a kid.
The results were almost instantaneous. I couldn't understand why I couldn't drive home, because I felt like I could see really well enough to drive home, but I'd have somebody take me home.
In addition to cataracts, there are other changes going on in our eyes as we age. Our eyes, like other parts of our body, actually fall out of balance with age. This means that the outer focusing lens of the eye, the cornea, and the inner focusing lens of the eye, the crystalline lens, no longer work as well together. The result is vision that is not as clear and crisp as it was in our 20s. And cataracts only make the problem worse. In the eye of a healthy young person in their 20s, the cornea and the crystalline lens are in balance and work well together. The cornea has what scientists call positive spherical aberration, and the crystalline lens is what is called negative spherical aberration. The result of this balance is that light rays, as they pass through the cornea and the crystalline lens, are properly focused onto the retina. This provides clear, crisp vision in both low light and bright light conditions for most people. As we age, the spherical aberration of the crystalline lens begins to change. The result of this change is that the cornea and lens, which worked well together when we were young, become out of balance. When these two focusing lenses get out of balance, the light rays entering the eye no longer focus as sharply on the retina. And the clear, crisp vision that we had in our 20s is not quite as sharp. In medical terms, this is called a loss of functional vision. The result is that many older people quit driving at night or reduce other low-light activities. Traditional IOLs have been used to treat cataracts for the past 30 years. While replacing the cataract with a traditional lens implant greatly improves vision, it still leaves the cornea and lens somewhat unbalanced, like that of a healthy older person instead of like that of a healthy younger person. So if vision after cataract treatment with a traditional lens implant is good, but not as good as it could be, well, what are your options? Thanks to lens implant advancements that restore the balance between the cornea and the lens, today's answer for safer, sharper vision after cataract treatment is the TECNIS lens implant.
After I washed my face, I said, oh my gosh, everything looks brighter. And then I picked up the newspaper and I couldn't believe it, you know, how sharp the print was.
Go from not seeing like cloudy, and then all of a sudden you see all the lights and all the wrinkles in the dirt and everything else.
Actually, I opened the door and looked outside. I live out in the country, and man, everything was just so sharp and clear, and I just didn't expect that.
It definitely is a whole new world for people that can't see.
The TECNIS IOL was developed using an advanced optical measuring system called wavefront technology. With wavefront technology, optical scientists and eye physicians were able to scan the cornea and natural crystalline lens of a representative sample of the population. Based on these advanced wavefront measurements, optical engineers created the patented TECNIS IOL with a modified prolate lens surface that allows the TECNIS lens implant to function more like the natural lens found in a healthy young adult's eye, instead of functioning like the natural lens typically found in a healthy older person's eye. The result is a lens implant that helps provide clearer, sharper vision in all light conditions. Clearer, sharper vision. When we hear that, most of us think of 20/20 vision. If we have 20/20 vision, it simply means that under those ideal conditions, we see at 20 feet what a normal person with good vision sees at 20 feet. The eye chart, however, doesn't always represent how we see in real life in different light conditions. Look at the same eye chart in low light. With a traditional lens implant, contrast sensitivity is reduced. Notice that the person still has 20/20 vision, but they don't see the chart nearly as well as they could with the TECNIS lens. Recent clinical studies have shown that a loss of functional vision when driving in low light conditions can make it more difficult to detect objects and road markings. This is where the safety benefits of TECNIS technology are most apparent. In fact, based on the results from a driving simulation test for performance and function, the Food and Drug Administration approved claims that the TECNIS lens improves functional vision, which may improve patient safety for other life situations under low visibility conditions. Or to put it simply, improved vision means improved reaction time, which could be the difference between being involved in an accident and avoiding one. A U.S.-based clinical study showed improved contrast sensitivity with the TECNIS lens in low light conditions. While the improvement was not statistically significant in that study, other studies have shown a statistically significant improvement in contrast sensitivity. One study, for example, showed that the TECNIS lens may provide an improvement in contrast sensitivity up to 31% in bright light conditions, and up to 53% in low light conditions compared to a traditional spherical lens. In the following simulated driving scene, notice how difficult it is to see road signs or other cars when contrast sensitivity is reduced. In the daytime, many people with a traditional lens implant see like this. But with the TECNIS lens, contrast sensitivity may be improved up to 31% in bright light conditions, making images clearer and more recognizable. At nighttime, the difference between vision with a traditional lens implant and TECNIS can be even more dramatic. Contrast sensitivity with the TECNIS lens may actually be improved by up to 53% in low light conditions when compared to a traditional lens implant.
In the year 2002, the National Highway Traffic Safety Administration's figures show that drivers the age of 70 or older were involved in 12% of the fatalities for themselves or passengers in their vehicles. They were also involved in 17% of the pedestrian fatalities in this country. Those are huge numbers.
In the 1980s, researchers showed that the addition of a third rear brake light on automobiles provided an additional 0.35 seconds of braking time for drivers. As a result, it was required by law for all new automobiles in the United States, Europe, and many other countries. According to a Potomac Institute study, the addition of these third brake lights has had both a safety and economic impact, preventing tens of thousands of injuries and saving hundreds of millions of dollars in property damage each year.
The TECNIS IOL lens increases reaction time some 43% over the third brake light. This is significant, especially in the older driver and especially in night driving environments.
In a simulated night driving study, the TECNIS IOL was shown to provide 0.5 seconds of additional reaction time. That's an extra half second to apply the brakes on your car after you recognize an object. This half-second increase in perception and reaction time is functionally significant in increasing your ability to take evasive action, stop, or lessen the effect of an impact. So what is the value of this extra half-second of reaction time in terms of stopping distance? Let's look at the following example of what is gained in stopping ability with the TECNIS lens compared to a traditional IOL. In this simulated driving scene, we see a car at dusk pulling up from a driveway. With a traditional lens implant, it can be difficult to detect objects such as another car on the road when lighting is not ideal. This can significantly increase the risk of an accident. But with the TECNIS lens, notice the improvement in functional vision. When objects on the road are recognized and identified sooner, a driver can stop sooner, up to 45 feet at 55 miles per hour. This can create a meaningful safety benefit for older drivers, the passengers in their cars, and other drivers and pedestrians with whom they share the road.
I didn't feel a thing.
I was in and out of there in less than 2 hours.
It was painless.
Tossed my contact lenses. I got rid of them.
I saw his face really clear for the first time.
The first thing I did was turn on the TV to see if I could see the television.
Now, let's get my other eye done.
If you got cataracts, you know what it's like. You're going to want to have something done that'll help you, and this will really help you. It'll make you feel good about things again.
I can't run faster and jump higher, but I can see better. I would recommend it to anyone.
If you or someone you know has a cataract and wants improved vision in all light conditions, including night driving, ask your doctor about TECNIS. TECNIS, safer, sharper vision.